Start with some straight talk. What are we really trying to achieve anymore when it comes to our pandemic protections? Coloradans are not dying of COVID in the numbers that they were. Our hospitals are not overwhelmed. It can feel like we're moving the goalposts. At the very least, we've been changing our goals. Anusha Roy has some perspective on what we really should be paying attention to.
There is one goal that has stayed the same.
Keep mortality down.
Which is why we've talked so much about hospitalizations. So why is the alarm being sounded on case counts?
So keep in mind that case count's kind of a precursor to hospitalizations.
The city of Denver says it's seeing the Delta variant circulate during the summer when respiratory viruses tend not to do as well.
We saw them drop last summer. And it's going up.
And for the state,
we are seeing cases increase, and honestly, just in the last week or so, we have now started to see a clear increase in hospitalization. Unvaccinated Coloradans now are really at greater risk than they've ever been since the beginning of the pandemic.
But doctors say this is about more than just the unvaccinated. They said keep in mind the immunocompromised who may not have as much of a robust reaction to the vaccine, kids too young to get their shots, and then what could happen down the line that would impact the community at large.
The more people we have unvaccinated, the more infections we have. The more infections we have, the more variants we have. And eventually we could have a variant where the current vaccine doesn't work at all.
The changing mask recommendations, regardless of vaccine status, and talks about case counts and Delta are also meant for prevention.
Based on the modeling data that we've seen, we think that we should be in a pretty good place when it comes to hospital capacity.
They're not threatened at this point in terms of the care that they can provide, but we don't want to get there.
Doctors say their goalposts haven't changed.
Obviously, it's veering us off and that more people are getting sick.
The virus itself did.
You can still enjoy time with your friends and your family, but knowing that status of vaccination is a big deal. I think that's something I would include in the equation.
So Dr. Barron there is talking about COVID precautions and weighing risks when getting together with people. And doctors are still saying that the vaccines are providing a high level of protection for the fully vaccinated, and that for the smaller number of breakthrough cases, most of them are mild and asymptomatic, Kyle.
Anusha, you don't have to look away as far as Florida to see states where things have gotten away from them recently.
Yeah, I had a really interesting conversation with an ICU doctor from Denver Health today who said that they've started getting calls from hospitals from other states. He's talking about Oklahoma and Utah, asking for help, saying they're inundated with COVID patients at this point and that they're looking for hospital beds because they're running out of space and capacity to take care of these people. That's a really tricky situation, though, because hospitals like Denver Health, they're super busy right now, Kyle. And it's not just because of COVID, it's because of other chronic health conditions, substance abuse, things that were not necessarily treated throughout the pandemic that's also filling up hospital beds right now.
We do have to remember that even if the hospitalized are surviving, if they're taking up beds that people need for emergency care, that's bad news.
Exactly.
Thank you, Anusha.